done.
Oh,
Yeah, why you stay next door? You come over for what?
Because I got all these bruises. That's very scary. Then I know you're a doctor, so can you please help me?
Come now.
Okay, thank you. Okay.
Oh, Brenda, how can I help you today?
I got all these bruises and it's very scary because they suddenly just appeared.
Oh, so can you tell me more about the bruises?
Yeah.
Anything else?
I don't think so, but...
Okay, so we'll address the issue of your bruises today. You can see you're very concerned by it. So alright, let me ask you a few more questions to rule out some possible conditions.
Okay.
So, do you have any symptoms like you feel very tired recently? You feel that you have lost weight recently? Fever recently have or not?
No. Oh, but then I think my niece have my sister's daughter. Then she got all these symptoms. She got fever. Then she got tiredness. Then she recently feel like, I think she told my sister she got fever.
Hey baby, why are you always walking so fast?
I don't walk very far.
You know I've been so sick over the past few days. They keep like that. I got fever.
Always sick one. I don't know why I always sick one.
I feel so breathless and tired. I feel like I got faint already.
Faint, yeah.
What you say?
I'm so sorry. No, that's not your fault. I really brave to go through everything. Go get some rest first, okay?
When thinking about leukemia, one must consider evaluating the three main cell lines of the blood, namely red blood cells, white blood cells, and platelets. It is common for the patient to complain of the following symptoms: fatigue, fever, increased infections, bleeding, bruising, and bone pain.
Madam Tan, I'm so sorry to hear about the incident. I hope her treatment went well.
Yeah, it's okay. She's okay already. Hey, ask you something. Do you think it's this thing called sepsis? Because my friend's son actually got sepsis, then he also got bruises, and then I think it's quite serious.
Oh my god, I have this huge paper on my nose. I have a date tomorrow, I need to squeeze it.
Saturday morning, jumped out of bed and put on my best suit. Got in my car, raced like a jet.
Oh, I got a flower for you.
Thank you, come in.
Okay, I don't feel very well.
Are you okay?
Disseminated intravascular coagulation, or DIVC, is a form of consumptive coagulopathy. In DIVC, there is a widespread activation of the clotting cascade. With the depletion of clotting factors, severe bleeding can occur from various sites. DIVC can be a complication of any critical illness, for example sepsis, and is a medical emergency.
I hope your friend's son is better now. But I need to ask you a sensitive question, Madam Tan. It's a bit, it's routine, okay? Have you ever had any traumatic incident before that you might have encountered such that you have these bruises?
Daddy, can some exam result?
Yeah.
No, please, give you a sign. The teacher say must sign. Please, sign.
Go and ask Mommy.
No, you must sign.
What is it? F? F, I think F already. Now we can study F. Type F already. You want to study F? He got F for his exam, no? What?
When faced with children with bruising, it is important to note the distribution of the bruises. Physicians should always consider if the child may be abused. Unusual sites of bruising include the buttocks, trunk, genitals, ears, and the back of hands.
Oh, no lah, nothing like that, don't worry. But then I appreciate your concern because actually recently I read a newspaper, there's a lot of this kind of thing going on. Yeah, so don't worry about me, doctor.
Okay, can I ask you a bit more about your past medical history? Because this might be related to the current condition you might have.
Okay.
So do you have any chronic illnesses or anything like requiring long-term follow-up?
Don't have, but then I think my dad got this thing called Hep B.
Hey ma, why my NS report Hep B positive what does it mean
Nothing one But give me, then I give you.
Okay nothing nothing okay. Can you help me get the bottle Hey, why my pen so bad? Eh? What happened? Why my arms are bruising? Why is my face so yellow? What happened? What happened?
Patients with chronic liver disease have impaired synthetic function of clotting factors, thus they tend to bruise easily. Clinically, the doctors should look out for stigmata of chronic liver disease. Further investigations would reveal deranged liver function test values and a prolonged PT or APTT.
Oh, I see. I hope that your father is on his liver follow-up for his liver condition. What about, since we are talking about family history, right, can you tell me more a bit about your family?
Other than Hep B, my father is okay. But then my mom got this, I think she got autoimmune condition. Then when she go into the sun, then she always turn very red.
Oh, I see.
You want a hot body? You want a Bugatti? You want a Maserati?
Hey, Dad! Come here, see? Like my sunburn isn't going off even after 1 week. And now there are like rashes everywhere.
Aiyo,
I've never had them before.
Oh no, maybe I should see a doctor to make sure nothing serious.
Yeah, okay. Do you have some concealer?
Oh yeah.
Systemic lupus erythematosus is an autoimmune condition with systemic manifestations, possibly involving almost any organ in the body. Patients with SLE frequently develop abnormalities in one or more of the 3 blood cell lines. It is possible to develop either an acute or chronic thrombocytopenia.
Oh, it must be very difficult for your mother.
No, she's okay already. She's enjoying her retirement.
Okay, that's good, that's good. Let's move on to the next topic. Can I ask you a bit more about any medications you take regularly? Do you have any drug allergies?
No, no drug allergy.
Okay, can you tell me the medications that you take regularly?
I don't take anything except multivitamins, but then my brother has to take this pill every day, but I don't know what it is. I think for his heart condition.
Don't, my anaconda don't, my anaconda don't want none unless you got buns, hon.
Doctor, did I get my ECG result how?
Yeah, let me tell you. You have irregular heartbeat. You actually have this condition called atrial fibrillation. You need to take this medication for it. You see? This one. You need to take Monday to Friday take one colour, then Saturday, Sunday take another colour, no? Okay, you know later you go to the pharmacist, she will explain everything to you. Okay. Can lah. Okay, thank you, Mr. Afuna. What is wrong with me?
It is important to take a proper drug history when faced with bruising, as it might be iatrogenic. A history of antiplatelets and anticoagulant use might warrant some revision and checks to the patient's outpatient medications. In this scenario, over-warfarinization is shown as a potential cause of bleeding. In addition, it is important to check for potential drug interactions with supplement use, traditional Chinese medicines, and alcohol consumption.
So, Madam Tan, let me just summarize what you have told me so far. Yeah, so can you tell me, do you have any idea how this may have come about? I can see you're very concerned about your condition.
Yeah.
So, actually, how would you like me to help you for today? I see. Okay, don't worry. After this, I will have a quick look at your bruises. Then maybe we will do some blood tests.
Okay.
What you can do is come back tomorrow again, around this time. Then I will discuss with you what we found through the blood test.
Okay.
Okay, thank you, Madam Tan.
Thank you.
This summarizes our approach to bruising in the primary care setting. Listed below are the common causes of bruising.